Welcome back, guys. Another episode of the Hawk Vision podcast. You know what it is, wherever you're listening, however you're listening, and now watching. We know you can be anywhere in the world, but we are glad that you're here to rock with us. You know what to do: like, share, subscribe, all the little proverbial things that we're forced to say in today's society. Uh,
Mhm.
these last few years as an adult, one of the things that we've all been focused on, whether it be day-to-day needs with COVID or politics, or has been a need for affordable health care. This week's guest has not only experienced the battle on the provider side, but now she's providing solutions with the launch of her new business. She is an absolute rock star, somebody that I have tons of respect for. She's launched a platform that allows people to see a doctor quickly through telemedicine, which is a huge industry right now. We actually connected through an entrepreneurship incubator platform, and it was such a natural connection. True visionary, board certified emergency physician, CEO of Your Caring Docs, all around rock star, and that's why she's here. Dr. Tamara Beckford, welcome to the show.
Thank you, thank you, thank you. Thank you for having me.
Absolutely. You know, like I said, we met on Paul's channel, it
Hmm.
was a no-brainer. We had to put this one together. And so I'm definitely
Absolutely.
excited to have you on, and of course to talk about all of your greatness and the things you got going on.
Okay, well, let's go. I am ready.
Awesome. I got my coffee because you know I'm a coffee head. I don't do nothing
Okay.
without it. So if you see me swigging, I'm paying attention. But of course, you know, I gotta refuel. Um, let's jump
Understand.
right in. Let's jump right in. Let's do the obvious. Tell us about your background,
Hmm.
how long you've been in medicine, and then we'll jump into how you decided to launch your caring docs and all that good stuff.
All right, sounds good. So I am originally from Jamaica, so JA.
Hey.
Born, yes, Yadi. So born in Jamaica, family moved to the US when I was 11. So I had visited before, but we officially moved here. And when I was 11, we moved to Newark, New Jersey. So that's where we live. So all our brick city people, they understand. So lived in Newark, New Jersey. That was junior high session. So junior high, high school. Went to the local university, which was Montclair State. At that time, it was a smaller university. It says now a little bit larger. So I'm an alum from there.
Okay.
After attending Montclair, so I did a bachelor's and I did a master's. So I have a bachelor's and a master's in biology. And then from there, I went on to med school.
Right.
In med school, went to med school in Newark. So right down there in Brick City again. And
Nice.
at that point, it was called the University of Medicine and Dentistry of New Jersey
Okay.
hyphen New Jersey Medical School. Now it's called Rutgers Medical School. So those who are looking it up and saying she don't really exist,
She don't
that's
go there.
why. She don't go there.
Now it's called Rutgers. That's so
It's
funny.
now called Rutgers New Jersey Medical School, right? So
Okay.
I'm an alum from there. So from there, I went and I did my training in Philadelphia. So I trained in
Philly.
emergency medicine. Yep, Philly. Emergency medicine at Thomas Jefferson University Hospital.
Okay.
And then from after I finished my training, I moved to H Town, Houston, Texas. So
Nice.
that's where I am. Been here now and practicing emergency medicine outside of training for going on 11 years. So
Wow.
yeah,
Wow.
so I've been there.
You've been there. A lot of schooling. You are better
Who
than
you
me.
telling?
Whew. You know, it's funny. I tell a lot of my listeners and everybody that asks, they always ask, they say, Chuck, you dropped out of college. Would you ever entertain going back? All that good stuff. And I absolutely would entertain going back. But I think that
Mhm.
it's a different animal when you know what you want to be,
Absolutely.
right? And so, like my
Hmm.
daughter, she wants to be. At one time, she wanted to be a pediatrician, and now she's hyphenating that between that and a lawyer. Um,
Okay.
but I was never that kid. I just knew I wanted to
Hmm.
be closest to the money. And so, with my
See,
first, yeah, it was. I know, but with
no,
my
no,
first
no, it's
college
not bad.
professor, it was. I was made to feel though, right? Because my first college
Hmm.
professor, When I found out how much he made, he was doing the whole go to school, get a good education, get a good job, all
Mm-hmm.
that good stuff. He said, and then when you guys get out, you'll be like me. You guys can at least be making what I'm making. And I won't say the institution that, killed this off for me, but as soon as he told me what he was making, I politely packed my bags and excused myself from the class. Um, because I was already making that selling cars, right? And so I think
Right.
he said $40,000-$50,000 a year, and this is back in
Mm-hmm.
'99, you
Mm-hmm.
know, and that's a good living then, But also I'm in California, so it's a good living
True.
everywhere
Absolutely.
but California, and so
Right. That is true.
all of that to say, kudos to your dedication.
Oh, thank you. But I mean, the thing
Absolutely,
about it though, as you're mentioning, I mean, this is a podcast about people in entrepreneurship. All of that was medical training. I'm going to be honest. I just started school again, the school of entrepreneurship. This is
entrepreneurship.
a different beast. This is not something that you're taught in medicine. Most of my
Yes,
colleagues who went to med school, like, were taught, as you mentioned, and that's one of the qualms, right? We're
right.
taught to be a worker bee,
Yes, very much
right?
so.
And
Very
that's
much
and
so.
that's what you noticed from earlier on, when it's just like go to school, follow these forms, and then boom, you go off into society and you're a worker bee. So I'm not going to say that would I change this. I love what I do, but I also love this new realm where I've stepped into, which is
Yeah.
entrepreneurship. But I've gone back to school.
Yeah,
Let's
yeah.
just be honest.
It's not a social media makes it look like it's the glamorous thing to do, and
Absolutely.
it's more work than I think everybody notices. I think that we spend a
Mm-hmm.
lot of time working in the business and not on the business.
Mm-hmm.
Right. And in the business, meaning that we do everything. We are the editors, we are the content creators, we are
Yes.
contract negotiation, right? We're every part of it. And then
Mm-hmm.
we don't get a chance, at least for some, we struggle to remove ourselves and then work on the scaling and the growth, right?
Yes.
And
Mm-hmm.
so my question would be for you, well, actually, before we get into that,
Mm-hmm.
what made you decide to launch your caring docs?
Okay, so as I mentioned, I have often thought about the fact that I have been trained to be in medicine and to just work. And I've
Yes.
often, even while in med school, I said, how's it that we're not really taught like the business of medicine? Unless you went and got an MD, they do have combined programs that are called
Okay.
MD MBA programs. So you'd have to literally, extend and do an MBA while you're also doing med school.
Yes.
So there are some people who have done that, but my med school was attached to a dental school. So when I say, yeah, so that's what's the University of Medicine and Dentistry.
Right.
So our school was attached. The difference was just really a door where the dental students were, there, and then the med students were on the other side.
Right.
And we had courses that changed. Like in our spring courses, they took in the fall and vice versa. But then
Yes.
one of the things that we noticed is by third year, we are, on the floors, or people call it the wards, that's the old
Mhm.
school term for it. And we're like,
Yes.
and we're there seeing patients, but the dental students, they had to go out and get their own patients. So they
Oh
learned that
wow.
whole marketing. Yeah. So they're like, learning how to budget their time, trying to get patients, get clientele, and how
Right.
to run an office in some respects. We were like on the floors, and
Yeah.
it was just a different beast. And in the end, I said, man, it's really kind of interesting how they learned that portion, but we didn't.
Right.
So now fast forward, it's something that's been in my mind, and I'm like, with my medical training, what is it that I can do that I would love to do?
Right.
I do love taking care of patients. It's, emergency medicine. So I see people all the time. You build a relationship quickly. You also have to learn how to also, gracefully bow out of that relationship, right? I mean, your
Right.
ER doc and y'all not on the, like, 3-4 days down the line still talking. So so in that respects, when I started thinking about it, I'm like, you know what, maybe an urgent care, a telemedicine urgent care, because I also want to be able to spend time with my family. I have two young
Okay.
sons. you know. And at the time when I started launching and thinking about it, my youngest son was a year, the other one's 3. So started working on this, and then boom, the pandemic hit. And I
Yeah.
was like, all right. So, you really have to move forward with this. So that's when
Right.
I really put the mind and just started grinding and looking at platforms and talking to, like, different companies and trying to figure out how I can, build this up. So the pandemic really just like kind of set forth all that's been going in my mind to just really get this going. So
Yes.
it's been a lot of work, as we mentioned. Entrepreneurship is not easy, but I love
Yeah. Yeah, it's funny. I One of the things that I heard early on, because my background in network marketing prior to
it.
corporate and HR was network marketing, and they always used to say, "You want to learn from the dentist, right?" And the dentist is king of marketing because what do they always do? They always book a meeting from a meeting, right? So
Mm-hmm.
before you leave the dentist, they always say, "Are we going to see you again in 6 months?
Six
Would you like to
months.
set that now?" Right? It's like Jesus, they're more on top of it than the supermarket. Um,
Mm-hmm.
in that
Absolutely.
realm, in that
Mm-hmm.
realm, does your or did your eye for emergency care help you triage the business in terms of this is what I need? Do you get to recognize things faster? Does that skill set shift over?
Absolutely, absolutely. So with your training in emergency medicine, we are able to quickly determine what we call the super sick versus the mildly sick, right? So the
Okay.
mildly sick are the urgent cares. So
Yes.
I know that some people hear the word urgent and they're trying to figure out like what does that really mean versus emergent. So the urgent cares
Mm,
are like your sinusitis, is your urinary tract infection, your ear infection, your strep throat. So those are
right.
what we consider like urgent care issues, in that you really don't need to go to the emergency room for that type of care.
Okay.
So with my training in being able to do everything, because as an ER doc, once you step in the room,
Yeah,
like
it's
that's
all
it.
lights
Like,
on.
yeah, gunshot wounds. If you got to deliver a baby and you can't make it upstairs, I'm gonna be delivering your baby. Like, if you're having a heart attack, that's me. A stroke, that's me. Appendicitis, like, that's me trying to
Jeez.
figure all of this out. But also, if you come in and you're like, my throat's sore and I got strep throat, that's me too. So I can, so I can
You're like
really
a
be able.
mom all day long at work, and that's what this is. Got it. Okay.
Exactly. Yep. Now you got it. So you can do it all, so you're able to really to decipher like, okay, well, this is super sick and this is mildly sick,
Right.
and that's what your training is. And part of your training as a doctor is really listening. And like we said, 80% of the diagnosis is really coming from the patient's history, so they'll start to tell you everything that's going on. So as you listen, you can start teasing it out, and you're like, oh, okay. And you ask,
Right.
of course you'll ask a few questions here and there, but the patients usually give us the diagnoses most of the time.
Sure. So,
Hmm.
in your business, have you noticed that you're able to identify where things are needing more attention faster than other things? Like, because I think for us, for entrepreneurs, we look at, especially in the social media age, we look at how's our reach, how's our interaction, where are our
Hmm.
likes, right? And then we start to worry about, wait a minute, where's the conversion, right? Like everybody's liking the
Right.
pictures, but where's the money? Are you able to identify
Hmm.
those things a little faster?
No, I'm seeing the same thing with that, because I do produce content every week.
Okay.
Another portion of what I do believe, because being a doctor really is from the Latin word to teach. That's all that whole doctorate and all the other stuff. So I
Got it.
do like to produce content in teaching the general public about what's going on within their body, so that they can make great medical decisions. So every Friday I produce content and I put it out
Nice.
there. With that in mind, you'll have the content, but the conversion, the likes, it's still pretty challenging bringing that over to the conversion portion.
Yeah.
So yes, that is true. The biggest thing that I like to put out is to train and to inform our population about the super sick versus the mildly sick. And as of late, we are in the pandemic.
Yes.
in this. So I've been putting out a lot of content about how to determine if you do have COVID, like when to go to the emergency room versus when you can be treated via telemedicine.
Right.
So those are some of the things. So yes, we've been able to take care of some COVID patients who've had mild COVID symptoms,
Okay.
and also to inform the other patients in our population who are, on our platforms as to, hey, this is when you can be treated in telemedicine. But if you're looking
Okay.
like this, bro, please go to
Right.
the ER.
The hard part about that for me, right, is you know how Target is like the best thing we can do right now, right? Like going to Target
Mhm.
is an event at this point. And when somebody like coughs or sneezes at Target, I lose it.
Uh,
I see, like my inner everything is like, right,
starts
and
to
I
shake.
blow up. Yes. And so, how do we? I know there's no real way to know, but
Mhm.
what are the chances, I guess, right now of a regular sneeze just being a sneeze and calming our urges to like help people get pushed out the door and buried under something so that we don't,
So
overreact
that you don't get
to
it.
COVID. Yeah.
Okay, so that's the thing about this virus. This virus is a tricky, tricky virus. And I'll tell you from someone who's like, treating it on the front lines.
Yes.
Um, Last year, going at the beginning of the year, COVID is a dry cough.
Okay.
So, you're like, okay, and you hear that person with a dry cough, rest assured, I mean, we'll talk about the mask and all these other stuff, of course, but
Absolutely.
just, hearing COVID is a dry cough. And so you're like, okay, good. Someone had a wet cough. The likelihood of it being COVID is low. Now, the wet cough is when that person, almost like that smoker's cough with,
Yes.
yeah, that's
The
that
hack.
wet cough, but you just like hack, yeah. And you're like, woo. So now, as of late, you're hearing these wet coughing people with phlegm, and then now that's also COVID. So I'm like, this virus is changing.
Yeah.
So with that in mind, it's so hard to really just pinpoint that if I hear this person coughing, before if it was a wet cough, I'd be like, ooh, well,
Right.
less likely. But now anybody that's coughing, fair game.
We push
You know what I mean?
everybody out of Target. Is what you're telling me. Yeah, we okay.
Cool.
Put
Got
your mask on, put
it.
your face shield on, and if you're gonna cough, even with all of that, I still want you to cough in your elbow.
I
How about
love it.
them
I
apples?
love it. And just for this is a Hawk Vision statement. This is not doctor saying push everybody out of
That
Target.
is a hog vision statement. You're
Yes,
carrying dots. You're not
come
gonna
see
push people
me
out of
if somebody says no, all
if you're
jokes aside.
oxygen.
Right.
Absolutely.
No, I respect licenses by so much. Let me ask you this. Were you
Mhm,
intimidated by and I use that word loosely, but were
mhm,
you intimidated by getting into this space where you have these major hospitals doing telemedicine and you have a startup like JetDoc who's jumped into
mhm,
space as well?
mhm.
Um, how did you feel about getting in such a competitive space?
So yes, at times it can be intimidating, but then I also have to look at my purpose, right? So when I do go about, when you're using your caring docs, I mean, it's
Yes.
me. And that's kind of one of the reason why at this point I haven't like tried to expand too quickly, because I want to set the standard of care. You
Yes.
see me, and my standard of care is high. So when I'm seeing my patients, they know what they're going to get. When I'm, talking to the small business owners and, pushing and saying, hey, I'd like to be the doc for your small business, they know what they're getting. So
Okay.
your standard, once you set your standard, then you can go out, at least is how I look at it, and then expand because I've already set that standard. Now, when am I saying that the other companies are not doing that? No, I'm not saying that, but I know my own standards. And
Right.
so, although it can be intimidating, I'm not going to let it intimidate me because I know my reasons for going into this. I know the type of care that
Yes.
I produce. So it's just okay, well, just keep showing them, like
Yeah.
we say, show and prove.
I love it. I love it.
Yeah.
And to your point, like you walk down the pet food aisle, right? You walk
Hmm.
down. I'm a fan of Rottweilers only. That's the only dog I like. Um, but there's what, 50, 60 brands of dog food. So when people are
Mhm.
getting ready to launch a business, I tell everybody, you don't necessarily have to be the only one in the game. There's enough money
Right.
to go around. And so
Absolutely.
you have, I believe, 2 states currently up and running, correct?
Correct. Yep. Texas and New Jersey. I wonder why.
I,
Does anyone?
geez, I don't know. I wonder. Uh, um, is there, how do you go about expanding in this space, in this field? How do you
Mhm.
go about expanding into additional states, or what does it take to get approved by the state of Texas to provide this care?
Well, Texas did well. I'll start off by saying this. With COVID being around, it has helped the space with telemedicine.
Mm,
Texas did allow telemedicine from before, but
okay,
we do keep in mind when the pandemic hit, there were a lot of patients who were not going to the hospitals, right?
right. No insurance.
And well, not only that, they were afraid.
Fair.
Yes,
Fair.
but they still needed care.
Okay.
Yeah, and with that, having telemedicine helps to provide the care. So I provide urgent care, but
Okay.
there's still other avenues that can still be done through telemedicine. So with that being in mind, in order for me to, if I continue as just a solo person, which I mean, I don't plan on continuing to just be solo. I do want to
Sure.
have additional providers with me. I would just need to just get licensed in that state, just a medical
Okay.
license to provide the care in
Okay.
that state. So that's the difference, and also adhere to their telemedicine rules.
Got it.
Um,
Okay.
mhm,
So is
yeah.
it similar to, like, I know in life insurance, once you're licensed in, say, California, you can, just pay an extra fee, and sometimes it's like a 5 question questionnaire. Is it similar in medicine, or is it, a little bit different?
You mean an extra fee to get another state?
Yes.
Actually, there are a few states that do have a combined licensing,
Oh, nice.
one group. Yeah, but Texas is not one of them, and neither is New Jersey.
That's so
But
funny.
there are a few states that have decided to connect and be able to provide licensing. So if you fill out one application, then you'd be able to license for those states. However, there are some caveats, like for example, you have to live in at least one of those states
Okay.
in order for you to qualify for that.
Got it.
So, but not all states have done that. I mean, it would be nice if we can, use an application and be able to provide their licenses throughout the United
Yeah.
States. But now most states have their own licensing. So you
Mm.
have to apply to them individually, excluding what I just mentioned.
You got to get
Mhm.
those fees. The state has to get those fees. Listen, it's all about the money. Um,
Yes, it is very expensive.
absolutely. Well, which leads me to my next question.
Mhm.
In this space, in telemedicine and telecare,
Mhm.
can we discuss funding? How do you approach securing the funding for both the launch of the business as well as partnerships? I don't want any trade secrets, right?
Oh,
But
no
how do
trade
you
secrets.
approach how do you approach launching a business on this scale, in multiple states? During a pandemic, how did that happen?
You ready for this?
Of
Savings,
course. Wait, hold on. Let's do coffee.
coffee,
We are ready.
savings.
I knew you were gonna do that. I knew you were gonna do that.
Yes, savings. Like I literally, like my husband and I, we really organized ourselves over the last few years
Okay.
and really put some money aside to launch. I knew that entrepreneurship was something that I wanted to do.
Nice.
So we really just organized our finances in order to be able to do this.
I
So
love
right now,
it. So what's so that's gonna make me ask the question. It's gonna make me ask. One person is typically the visionary in the house, and the other
mhm,
is typically the support person.
right.
With being the mom and the visionary and the risk taker, one, we need to make sure husband has some whiskey, but two, um, how does that communication look when you are, you're caring for people still 9 to 5?
Mhm.
or weird hours, because I know my mom is in healthcare too, and there's no such thing as actually a 9 to 5. It's
Absolutely.
6:30 to whenever the relief comes.
Yes.
How does that communication look to be able to do both and chase this vision of greatness that you have for yourself?
I have a great partner. My husband is like, he allows me to be me. As you
Yeah.
can see, I have a personality.
Absolutely.
And he's definitely super supportive. So he brings me down when I need to, but he also he also encourages me. And I have a lot of support from both of our parents. Like,
Okay.
so my in-laws, very supportive. My parents, I mean, it's my parents. You know how it
Yeah.
is. They're
Yeah.
very, very supportive. So in my household, I'll tell you that, with ideas, and when I come up with creative ideas, my husband is definitely the type of person that's like, he likes to do the behind the scenes things. And I had to actually come up with learning to respect that about him, because people
Yeah.
who come up with ideas love to give other people ideas too, and like to push other
Absolutely.
people in the forefront, like, yeah, you should do this.
Right. Right.
But then I started to realize, and I asked him, specifically, I said, is what do you want to do, this? And he's like, no. And then but he's good at networking. That's what he does for his job. But then
Okay.
I realized that with all of that, he likes to help to support me by helping to push me forward. Because as we mentioned, I went to school to be a worker bee.
Right.
So this is new to me. And so he, in his portion, he trains me a little bit behind the scenes, and he absolutely supports me and pushes me forward. And so I get tons of support. That's
I
why I feel
love
so
it.
comfortable coming out there.
Yeah. Yeah. No, it matters.
Yeah.
I think that people that are in relationships, my dad used to tell me, if you marry a dreamer, what was the statement he said? If you marry a dreamer, be prepared for either extreme heartbreak or extreme happiness, but just know that you signed up to marry a dreamer, meaning they are always walking that line of absolutely grateful, but nowhere near satisfied. Right.
Mm, your dad's good.
Yeah. You listen,
No, that's
greatest man
true.
alive. But it
That's
is. I think, like you said,
wow.
we we
Wow.
we are not immune to the fact that, or we don't ignore that we have this level of achievement. We're happy, we love our spouses, all that good stuff, but
100%.
in the back of our mind there's like, there's some more.
That is
There's
so true. I mean, that statement is very profound, and each second it's hitting me more and more. That statement, I'm like, wow, your dad's right. Because I mean, we do have this. It's the 2 a.m. Like, yeah. Oh my God, I got a new idea. Let me get my book out. Let me write this
yes.
down. Let me, and it's a constant level of evolving. And so you're right. There is a level where you have to kind of saddle that area of being content, but still
Yes.
pushing for a little more. So my poor husband, I miss him.
Trust me, I believe that if your husband and my wife sat down, they would have stories that we probably know nothing about, right?
That's so true.
Because we were busy, being
Dreaming
visionaries and dreaming and doing.
and writing out a new plan.
Exactly, exactly. I love it. I love it. But it's a thing.
Hmm.
I want people that watch this podcast. We launched it with the intent to help people shorten the learning curve. And so
Yeah.
I always bring it back to that part, because whether you have a spouse or not, if you're dating, if you're dealing with someone, they have
Hmm.
to understand what dating a visionary, dating a dreamer is like, right? Or
Yes.
being married to someone is like. It has nothing to do with the fact that we aren't enjoying how great you look right now. It's just
Oh,
our mind drifted off into creation mode, right? Or implementation
yes.
mode. Like,
Yes.
I understand. I understand.
Yes.
Like, dinner was amazing, but I can't wait to hurry up and finish eating because I want to go do this. Like,
Yes.
while I'm thinking
Yes.
about it. Yeah.
It's my mind. Like, I'm not looking through you. I swear.
I swear I'm paying attention. I just didn't hear the word you said. Got it. Let me ask you this. How much time do you put into your personal growth, whether it's profession or business? How much time
Mhm.
do you spend being a student of the game?
I'll say, I haven't calculated hours wise, but I'll tell
Sure.
you this. From Wednesdays until Saturdays, hardcore.
Really?
Like, yeah, because like as I was mentioning to someone earlier, I'm like, I went into medicine. I understand delayed gratification. Let's put it like that.
Hate those two words.
I know, but for me, I have to learn it
Yes.
because this is me switching from just looking and studying science to
Right.
studying, like, how people think. Marketing, people might think marketing is just throwing up a logo, but no, it's a
Right.
mindset. You have to also invest in your mind, where there are times when it's often been stated, and it's true, that entrepreneurship is a lonely road, right?
Very. Yes.
Yeah, so
Yeah.
there are times when you feel very alone, and so you lose motivation. And for me, I'm big on mindset, because I realize that that's my big driver. My mind
Yes.
is where my creativity comes from, and therefore I have to invest in it. So when I'm feeling down, I have to try to figure out, am I feeling down because I do not want this, or this is just a part of the trajectory? Honestly,
Mm.
it's a part of the trajectory. And so what do I do to bring myself back up? I invest in my mind. So I, watch a podcast. I listen to a podcast. I listen to others who are doing things that I want to do. And
Yes.
if now I will know that this is not for me, if I don't leave out of that podcast and I'm like, yo, I got a new idea.
Now there's
Or,
something I
yo,
can do. Yeah.
yeah, or
Yeah.
I'm not amped. Like how those who play sports, and before you go out on the court, before you go out on the field and you do your amped up, that's it for me. Like,
Yeah.
I listen. And so, yes, I'm listening to the audiobooks. Like, I,
Absolutely.
I
Yes.
listened to your podcast last night, and right
Oh
after I
my
listened to an
God.
audiobook. Like, I mean, that's how
Thank
much I
you.
have to invest. No, it's real. You have to invest in yourself, especially if you're moving from an industry that this is not your regular industry. You can't be
Right.
disrespectful and think you're just gonna step in there and blow up. Like,
Yeah.
people have been
Yeah.
working at this for years and years, and then all of a sudden you're just gonna be the one that stepped in it, and 20 minutes later that's you.
Right.
Like,
The automatic win. I think that
no.
that's the part that we miss out in terms of communication, right? Because
Absolutely.
a lot of entrepreneurs, I won't even say that. We watch a lot of celebrities launch a new brand, and we
Hmm.
forget that they have an entire team behind them. So like The Rock just came out with his tequila, and it's actually pretty good. But
All right, I need to try that.
yeah, like and Uncle Nearest, who I absolutely love, my favorite whiskey in the game. Shout out, feel free to be a sponsor. Um,
Uncle
they
Nearest.
have, oh my god, my favorite whiskey ever. I think and I
Hmm.
could go off on a tangent about that, but smooth, no chaser needed, on the rocks. It is absolutely what you need at the end of at the end of a mental day. I'll
Absolutely.
say that. But I think that we forget that we compare ourselves to what we see online often today, and
Absolutely.
we forget that a lot of people have entire teams behind them, right? They
Hmm.
have editors, they have account reps, they have coaches, they have all these things, and then we're sitting here with a laptop, a dream, and $1,500, trying to make it work.
Absolutely. Trying to make $1 out of 15 cents.
Yes, yes. And so I think it's important to understand that there is a trajectory, like you mentioned. There's a
Hmm.
trajectory where we will have ups and downs, peaks and valleys, but the why that you
Absolutely.
mentioned earlier is
Hmm.
what keeps us going. Um, to that vein,
Hmm.
when did you know this was real?
I think I knew it was real when I got my first patient. And I'll tell you this. So when I got my first patient and I took care of that patient, of course, to the best of my ability.
Sure.
And then I realized, I'm like, this is something that I have been doing for family friends all this time
Yes.
for free. Not
Yes.
that I would okay, but I'm like, I can do this. This
Yeah.
is something like I can really do. It's not only that I am trained to do it, but this is
Right.
something like I have the skill set. I have the skill set, I have the personality, I have the tenacity, I got the drive. I'm willing to put in the work. I'm
Yes.
willing to go to the master classes. I'm
Let's
listening
go.
to the master classes overnight. I'm taking that nap and then listening to another one. I'm listening to the audiobooks. I'm listening to, the motivational speakers. So I'm and the thing about it is that even with all of that, I still am motivated and I'm still hungry and I'm still happy that I made this decision and I'm still working full time in the ER in the pandemic. Let's just say.
All around rock star, and
All
if there was a myth, it is true because Jamaica. I
I
don't
still I got
know. I don't know. Paul would get on my head if I didn't get out here and say shout out to Jamaica, for the
that's
work
right.
ethic, and those
That's
are my three words: vision, work ethic, and belief. And
mhm.
you are every part of what those three words mean. Um, answer. I have so many questions. There's not enough time. Um, where do you think, if it applies, where do you
Mhm.
think the disconnect is for our community in regards to the way we approach healthcare professions? And the reason that I ask that is my career prior to network marketing, of course, HR as a recruitment for a healthcare organization,
Mhm.
significant time as a recruiter. And one of the things that I noticed is that the higher the level of the position, the less the talent pool looked like us. And we would love to get into the hospital, right? We love to
Mhm.
get the union role and get the benefits, and now we're union and we're protected, but we don't typically scale our careers. Can you talk to me a little bit about that?
As in scale, as in like entrepreneurship within
No,
the
even
hospital.
even in the 9 to 5, right? So let's say
Mhm.
someone starts as a medical assistant,
Mhm.
and no shade to medical assistants at all. I'm just using
No,
the
no,
job title
absolutely
because
not.
you guys are
Mhm.
literally the linchpin from getting
Mhm.
us, to our help.
Absolutely.
But you start as a medical assistant, you join the union, and then 15 years later, you're possibly still a medical assistant with just a lot
Oh,
of seniority,
okay.
right?
Absolutely. I see
And
what you're saying. Mhm.
yeah, so my question is, why? Where's the disconnect in knowing that we should ramp up our careers to provide better service and an example to those that
Mhm.
come behind us?
I think some of it, of course, it's a multifactorial answer, but
Yes.
one portion of the answer is mentorship.
Mm.
Absolute mentorship. I am an ER doc in my ER right now, even though we have another Black female physician in that actual hospital.
Yes.
Um, in the group, there are three Black female physicians,
Okay.
and I'll say that one of the things that I try to do, and I'm pretty sure the others do it too, because one of my other colleagues, the one that we work with, we actually went to med school together. So I've
Oh
known
wow.
her.
Okay.
Yeah,
Nice.
so I've known her for a while. She is also an entrepreneur,
Okay.
and we work opposite shifts, so I never see her. So I know I can speak for myself. I mean, I'm a
Sure.
night doc. I work overnights.
Okay.
So when I go into the hospital, I know that and what you're talking about is our ancillary staff. Our
Yes.
ancillary staff are there, and a lot of the ancillary staff look more like me
Yep.
than they do more, the majority. I make it a point to talk to my ancillary staff and ask them, what are you doing? Where are you going? What are you trying to achieve?
Yes.
On a consistent basis. And I see how I can help them achieve it, because there's some times when people are either they're afraid to ask. Some people, of course, is pride, but some people
Yes.
are afraid to ask. But if you approach them and you put forth the interest in them,
Mm,
then there's some blossoming that can occur in that respect.
absolutely.
um I try to do that personally because I love to see people advance. I love to see your potential. I see the potential, but I like to see you manifest that. And it's always good to actually see it in their face when they're like, yeah, I'm actually graduating from this particular thing. Boom. Love it. I
Yes.
also provide mentorship for, we have medical scribes. So these are students who want to go
Okay.
into med school. I provide mentorship for them. Like I'm writing letters of recommendation like it's running out of style. Okay, let's try to get you into this medical school. Let's try to get you into this
Yes.
PA school. So I've had I'm pretty sure, yeah, one of my scribes, she's actually graduating. She'll be graduating from PA school at the end of this year. And, she was
Nice.
my scribe. I, wrote her a letter of recommendation in addition to some other people. I have another one who she's in grad school now at Rutgers because I'm like, got her out of Texas. I was like, you need to go
Listen.
where, you can blossom. And so
Yes. Yes.
I think that that's a big part. You have to show the interest in our community because if you have someone there and they're rest assured if someone's a medical assistant and that's where they're starting out, that's
Yes.
usually something of a little bit of a convenience for them at that time whenever they got that job, right?
Okay.
Maybe there are a
Yes.
lot of things that's going on and this job, it's good, it helps to provide food, but let's find out where your vision is. Let's talk about where's your hawk vision, right?
Let's
Where is it
go.
that
Let's
you want to
go.
go? And then let's see if we can help you. Because even if you help that person to move on, like say they're a medical assistant, but they really want to do nursing,
Yes.
do that. All right, let's take some courses because one of the things is that time is going to go and move regardless, right? So
Yes.
if you take one course a semester and it takes you 8 years, or it takes you 6, 4, 5 years, those 6, 4, 5 years we're going to move irrespective of if you did
Yeah, they're
anything.
going
So
anyway.
why not just try? And then when that person moves on, they can probably help somebody get that position because there's going to always be someone who needed that jump start from that
Yeah.
MA position when you move on to nursing, right?
Absolutely.
It's a
Absolutely.
perpetual, you gotta help and you provide the guidance. It's so heartwarming to just see it when you provide guidance and then someone's like, yes, now I'm blank.
Yeah. Yeah. So that leads me to two questions.
Hmm.
One would be, I just, can you tell I have so much, like I want to learn, like I think the one joy, real quick, the one joy that I
Hmm.
get out of this podcast is that I get to learn from everybody that's on. And so while I have my area of expertise, the
Yes,
best part of this show is that this is personal growth in real time for myself as well. Right.
absolutely.
And so two questions came from out of that you just spoke about. One, why is nursing school so hard to get into? Why is, everybody knows we need healthcare, and especially right now with the pandemic, and it's always been a profession that, they always joked about, it's never going out of style, somebody always going to be sick, right?
That's
why is
true.
why is nursing school so hard to get into?
I'm not sure. I
Is that a
I
California thing, or is it, like, because I hear it all the time, like, by the time, it's almost like people are getting accepted into law school when they get it, it's so hard, so competitive. What do you think
uh
that is?
so it might be the amount of schools versus the amount of applicants. So supply and
Okay.
demand, that's usually a supply and demand portion
Okay.
because I I'm not sure. I have never looked into how hard it is to get into nursing school. What I
Yeah.
can say though, as somebody who is a almost, I guess at this point, the fact that I'm going back to mental school, say like a lifetime learner, is
Yes.
that
Yes.
I mentor. Part of the portion of mentorship is just being honest and being real with people, right?
Yeah.
So one of the things with entrepreneurship is like, even like I was on with our friend brother Paul, and he was like,
Yes.
you always got
Yes.
to have the end in mind, right?
Right.
Always have to have the end in mind. When you are trying to get into the professional schools, you also have to have the end in mind. So if you have to approach these things with a strategy. You want to learn as much as you can from, the onset. But if they say grades matter, you try to get the grades.
Yes.
Now, from a strategic standpoint, right? If
Hmm.
they're saying that you need a 3.0 or a 2.75, or I'm not
Right.
sure what the particular GPA is,
Sure.
you put yourself in a position to get that. So, what that means is that you're not going to rush and take 16 credits and or 18 credits and working full time. And also, let's just say if you are a parent and being
Yeah.
a parent and all that, like, it's not because you want to get there in 2 years. Like that's not being strategically wise.
Mm.
I am not saying that people are doing that, but I know that this is something that we have to keep in mind. If it's going to take you an extra year, but you can get your grades and you can bust it out with that higher GPA, you do it that
Yes.
way. But you have to be strategic from the onset and be around people who are going to give you great advice. Don't
Yeah.
be around the cookie cutter advice. Not one advice works for everybody. And that's one
Right.
thing that I usually tell like my mentees, like the advice that works for one person is not going to always work for you. You have to be strategic. Like you look at it from like look at the long game. Like, how can you maximize what you're doing in order for you to get there? Like one of the things that people don't understand about like GPAs, they don't understand this whole weighted system. When they say it's a
Yes.
weighted GPA, you know what that means? You go in that door kicking. Like don't go in the door coming down with like a D or a incomplete or an F in the first semester.
Let's leave
You're
my
gonna be
transcripts out of
working.
this, please. This is not an interview for Chuck. We are interviewing.
This is life. No, but it's just like some people. I try to explain this, and I try to explain it to like some of the people whom I mentor, and I'm like, you just got to understand the game. It
Yeah.
really is a game, and people might get upset and just like, am I dogging higher education? No, I'm not. I'm just putting out there for those who have never had it broken down for them. They need somebody who's been through it, who can break
Yeah.
down the system for them so they can be successful. Because
Absolutely.
if you have others who are coming in and they already know the game and you're coming in like, oh well, I'm going to try to be a superstar and take all these courses, but then you're getting low grades in these courses because you're juggling so much.
Right.
No,
Right.
let's help you be successful.
Yeah, I tell my daughters, I have one, my youngest daughter still is doing word problems in school, right? This is the one that wants to be a pediatrician slash lawyer slash whatever it is
Okay,
this week. But in word
I love it.
problems, I tell her that they often give you more information than you need because the questions are designed to trick you. So
Absolutely.
I want her to be able to look at the questions, yeah, and
And
say, okay,
critical.
first sentence doesn't matter. Third sentence absolutely matters. Fourth sentence absolutely matters, and this is the
Mm-hmm.
question, right? So that you can filter out what you need. I think
Mm-hmm.
that what helped me in school when when I was there is that I understood that everybody had a style in which they asked their questions, and they had
Absolutely.
a posture about the type of answer that they wanted given our different professors. And
Mm-hmm.
once you learn that, you learn how to answer the questions, right?
Yeah, it's a strategy.
Yeah.
And unfortunately, some people are not taught that it's a strategy and they think that it's just by happenstance. It's not by
Yes.
happenstance. It's
Yeah.
not,
Yeah.
but so to go back to your original question, it really is that I think that we just need more mentoring as a part of the solution. It's not going to be the whole solution,
Sure.
but mentoring is a part of the solution so that we can have our people learning how to think critically, because those critical thinkers, just like what you're teaching your daughter, are the ones who turn into the thought leaders, right?
Yes.
That's how
Absolutely.
that so once you've already on that trajectory, you've already learned how to think critically, so no one's gonna come and fool you.
I love it. I love it. Who was the mentor for Dr. Tamara Beckford? Who was the person that helped you create a bigger vision for yourself?
So my first mentor started in the home, my dad. So I'm a daddy's
Oh,
girl.
yay. Shout out to dads.
Shout out to Daddy Beckford. So yeah, so he was one of my first mentor in that one, it helped, he helped me during those formative years to build confidence,
Okay.
to also um to be in an environment when it's like, you know how it is, you're the female and you might have a male in an environment, and
Yes.
so the president should be blank and the vice president should be blank, so
Right.
it's like, no, you can also be the president. So with
Correct.
that and his visionary, I went to an all girl high school so that
Okay.
I can he said that was his foresight, said, listen, I want you to not have to worry about having the societal labeling on you. You should be
Okay.
able to do whatever it is that you want to do and
Yes.
to be able to have whatever particular position that you would like to have. All right, so that started there. Then in college, actually, when I got into grad school, I think it was might have been my last year of undergrad slash beginning of grad school.
Okay.
I had a mentor. She's still my mentor. I just spoke to her not too long ago, a couple weeks ago, Dr.
Nice.
Sandra Adams from Montclair State University. So Dr. Adams was one of the first Black female PhD professors in the biology department or in the science department. So she has a double PhD.
Wow.
And I know, so Dr. Adams has in virology and in education and teaching, so pedagogy. So she helped me. I know, right? You're like, yo, yeah. So she
That's a
helped
lot
me
of school.
also. She's awesome. She's awesome, and she helped me with part of my confidence and transition and opening me up to when I said I wanted to do medicine. I've often wanted to. My trajectory was not a straight path. I
Sure.
didn't automatically get in. So when I'm here talking about the strategy, this is life that I'm talking about, that I
Yes.
like to impart. So she also helped me in that portion, to the point that after getting into med school, I still kept in contact with her. Residency, I still kept in contact. And when I was graduating residency, I said, I'm moving to Texas. Dr. Adams says, okay, you know what? I have my best friend from kindergarten who lives in Texas. I'm going to
Jeez.
connect you with her so that you can know one person. Because when I moved to Texas, I didn't know anybody. I moved out here
Wow.
by myself.
Okay.
Yeah.
Okay.
So, and so that mentorship has helped. Um, and then often I say sometimes some people, that's why you kind of have to, you never know how and your actions impact others.
Yes.
And there's some, of course, people usually think about negative impact, but there's also some positive impacts. When I was in undergrad, I would shadow physicians, and that's when I got introduced to emergency medicine. I shadowed this one female physician at this hospital in Newark, and I shadowed her, and I was like, "Yo, I like this."
It was
And
Grey's
ironic,
Anatomy in real life.
ah, but I will tell you that the infamous, three doctors, Dr. Samson Davis. I don't know if you've
Yes.
heard of three. Yeah, so he was actually her resident, and I was shadowing
Wow.
him. But I don't think he doesn't know. I've never told her. I've never said this.
Gotcha.
I
Gotcha.
haven't
Okay.
met him, so he'll hear about it. I haven't met him, since then. But yeah, he was a resident at the time, and Dr. Shapiro was his attending. And, I was there shadowing them. And eventually, next thing you know, I'm like, I know this dude. He's, one of the three docs. But
I
their
love it.
impact, what they do, it had an impact on you.
Yeah.
Even though I wasn't on the foreground or anything, I was there doing research. I was one of those little people trying to, build up my resume and so on.
Yes.
But it had such a positive impact on me. And lo and behold, I went into emergency medicine because of those experiences.
Wow. Wow. I love
Yeah.
it. I think it's always important to be able to connect the dots, right? There's always these
Hmm.
seminal moments in our lives, whether it's personal or professional, where we can say, that's the reason that I did the next step. This is what pushed me
Absolutely.
that way.
Hmm.
Um, for your caring docs,
Hmm.
how often do you have to remind people, like you said in the beginning, urgent versus emergent, and something like pink eye and sore throat doesn't necessarily mean your life is ending. But if I've never had these symptoms before and I wake up and I can't open my eye, like I feel like I just woke up blind. Like how does it
Right.
how do you
Absolutely.
have that conversation with this community, which I would imagine either doesn't have healthcare coverage or
Hmm.
is, we hear the term unbanked a lot. I don't know if unmedicined is a word. I don't know how to unhealthcare. What's the word?
I'd say underinsured. Is that the one?
Underinsured. There we go.
Yes,
How do you
absolutely.
have that conversation?
So and that's one of my reasons for starting this, is that I want those who are uninsured or those who have the underinsurance to know that they can still get
Yes.
quality care, and also to provide it at an affordable cost.
Yes.
Now, in educating the population about what can and what cannot be treated, what I have done, other than doing my Friday talks, in doing that, I also provide this information on the website. So when I
Okay.
had my website made, I really wrote out this. And if you see this, it
Right.
can be treated. So,
Okay.
in addition to really just explaining, I try to put as much information as I can on the website. So people,
Okay.
you jump on it, you read, like, yes, this fits my criteria. I also put what I cannot do on
Oh,
there so
nice.
that you do
Nice.
understand,
Yes.
like, hey, we do not treat this and that. But I think it's important to know, and that what can be treated, especially when you're at the urgent portion of things,
Yeah.
because after urgent becomes emergent. So if you can get something handled while it's at the urgent portion, then you can prevent it from becoming emergent
Yes.
portion, right? So once you get to the emergent part, then you're going to be paying a higher cost for the care. And
Right.
that's what I'm trying to prevent. I'm trying to keep people's money in their pocket, but give them
Yeah.
great care.
I love it. I love it. What's one thing that you wish somebody would have taught you in regards to marketing prior to jumping in? We hear email lists, we hear knowing your demographics and all that good stuff. What's the thing that they're not telling us out there, Dr. Beckford?
I'd say one of the things that I learned on our master class, and
Yes.
Paul's master class, is the one with Tristan Sutton, when he was talking about the
Yeah.
Facebook ads. So like, marketing, it's crazy. You think, especially, this is, like we say, barring aside the avatars and
Yes.
barring aside, the email list, when you're really sitting out there trying to, you made your little video and you're like, oh, let me hit boost. And it's like, no, you actually do not. That's not what you're trying to do. You're
Right.
trying to hit an ad, and then, trying to get your demographics. So all the behind the scenes thing that we learned on that masterclass, I
Yeah.
was blown away immediately. I told my husband, like, listen, well, I said, yo, but for the audience, I'd say the word listen.
Right. Right.
There's so many avenues and so much to learn. And even I feel like those who have gone to business school, because I have a cousin whom I speak to, she went to business school at University of Michigan, so she went
Yes.
to, like, you know, and
A
I
good
think
school.
things have, yes, but
Yeah.
things have changed so much
Yes.
between then and now. So I'm getting the School of Hard Knocks University, which I don't mind. I actually love it.
Yeah.
Love it. Like, so those things that, it's such a constantly evolving field, marketing, that
Right.
you can't use last 2 years ago's technique to try to market to
Yes.
today. So if you're not into lifelong learning, like they
Yeah.
say, this might not be for you.
I love it. It's funny. I just spoke to someone that owns a, what is it called? A recruiting office.
Mhm.
Jesus Christ, I can't think of the
Like a
word.
physician recruiting?
Similar, but office work,
Okay.
right? So temp work,
Okay.
temporary. Okay, there we
Yeah,
go.
temp.
Jesus Christ. So a staffing firm for temporaries, and one of the job descriptions she was talking about is they have to know Word and Excel. And I said to myself, people are
Back
still
then.
asking for Word and Excel. Like my 9-year old is killing it on Google Slides and spreadsheets on Google. Like who still does? And I think that is and one of the obvious examples of the disconnect, right? We're so
Absolutely.
busy with the standard that we forget that these people, I mean, these kids are light years ahead of
Ahead.
where we were at the time. And more
Hmm.
importantly, the technology is available. So the more that we constrict ourselves with what we think we know, right,
Yes.
we're costing ourselves money.
Absolutely, absolutely. Because while you're sitting there and they're worrying about, the, um, like for example, in that temp agency, that person might be going to work, let's just say for a doctor's office, right?
Yes.
And you're saying have to be able to do that Word and PowerPoint. If that doctor is probably trying to get that name out there, they need that TikTok, they need that
Yes.
Instagram. I need you to be able to do that and be able to just, put together and write an email, right?
Right. Right.
So
Yeah.
those
It's
skill
it's
sets,
crazy.
especially since you have so many in this day and age, you have a lot of platforms that can do some of those.
Absolutely.
Yeah. So
Absolutely.
yeah,
Getting close to wrapping up, I
absolutely.
have a couple of questions that I have to ask because I ask all of my guests.
Sure.
First would be, how do you define the word vision?
How do I define vision? Vision is seeing where you would like to be and working towards that.
Awesome. Okay.
Mhm.
Second question is, if it all falls down,
Mhm.
and God forbid it does, we believe in success and we are affirming absolute,
Mhm.
I mean, massive success. I want all 52 states and international countries for your carrying docs. Um,
Absolutely.
but define belief. What happens if we have to start over?
Interesting. If we have to start over, one of the things that I've often said is that I have so much creativity in my mind, and
Yeah.
we talked about it.
Yes.
if
Yes.
if the Your Curing Docs telemedicine does not pop off,
Yes.
there's tons of Your Curing Docs info in my mind.
Yeah.
Only way that it will not manifest is if somebody just hit me over my head and I get amnesia. But there's so much info that I am constantly writing down. And
Yes.
so I think, and this is what I look at too. I've seen others who've done businesses, right? They said that every business that you put out and launch, that might not be the actual business that works for you, but it might be a stepping stone to something
Right.
else. So while I'm here doing all of this, this is my daily reminder to myself. You do this to the best of your ability, but this might
Absolutely.
be a stepping stone to something of a bigger path. Like we like to say, "Afe make it." That's the Jamaican phrase. I
I
can
can
make it.
make it.
Afe make
My accent is horrible, but I know I love it.
it.
So before I do my last one, does that mean that we want to work towards, a lot of entrepreneurs launch their business with the hope of getting acquired? Is
Hmm.
that the end goal, to be
Yes,
acquired? Got
yes,
it. Got it.
yes,
Okay.
yes. Hmm.
Awesome. Awesome. Lastly, where is the seminal moment where Dr. Beckford knew that she was operating in her purpose?
I would say when I started to put this business together. I was putting it together with another colleague.
Okay.
And, the week before, a lot of things, like, we'd sign certain contracts and so on. And the person decided that, they didn't want to continue for
Okay.
certain reasons. And, I sat within myself and I thought about it. And I said to myself, well, at that point, you can decide one of two things, right? Are you going to go about this alone? Or
Yeah.
are you going to just say, all right, maybe this is not it. And, I prayed on it and I said, Tamara, you have a lot to offer. And, there's a lot at that point. You're carrying docs. I didn't have the name yet. I just
Okay.
knew what I wanted to do.
Yes.
And that's when it really hit me that I have a lot to offer. I know why I'm doing this.
Yes.
There's a lot of passion in me. I don't know if it's exuded through the internet.
It is.
but
Absolutely.
but so that's the moment that I said, you know what, I'm gonna go at this. And
Yeah.
I'm really gonna put in the work. And that's when I started looking for the different communities, the networking communities, because all of
Yes.
that is new to me. So that seminal moment was when I really sat and was at the fork in the road and decided that I'm gonna take the path that is the hardest path,
Yeah.
which is, but yet still can be the most rewarding path, because I really could have just continued working as a ER doc, and
Absolutely.
but
Absolutely.
I know there's more, and I know I can provide more, and that's why I am doing this. So.
I love it. I love it. Well, I am a huge fan. You know it from the moment we were in those breakout rooms. I was
Yes,
like, oh yeah, we're definitely gonna work together. Absolutely. Um,
absolutely, yes.
Definitely a fan. I can't wait for I want to see what the next state is. I have one in mind and I'm not, I won't jinx it, but I'm excited about what you do. One,
Thank you.
because it is it is what we need. If we're being
Mhm.
completely honest, it is what we need, especially with the changes in the national healthcare system and the laws and all that good stuff. But more so because there is an entire army of young healthcare workers that need to see people like you, right, doing this,
Thank
um,
you.
operating in the space of excellence, knowing that they can transition that to their own, at any time if they so choose, and if they have that vision, that work ethic, and the belief. So tell us where we can find your caring docs right now,
All right.
and where everybody can follow Dr. Beckford.
Absolutely. So you can find your curing docs for an appointment, to look at the website, see what we can and cannot take care of. It's
Yes.
at www.yourcaringdocs. That's URCARINGDOCS.com. That's www.urcaringdocs.com. We're also on Facebook at Your Caring Docs, the same URCARINGDOCS.com, along with Instagram. So you can find us there and on LinkedIn. So the same, we're on LinkedIn, Instagram, and we are on Facebook. And of course, the website is there for you.
Awesome. Awesome. Ladies and gentlemen, you've been rocking with the Hawk Vision podcast. Listen, all we want to do is bring greatness to you. So make sure that you like, share, subscribe. Also visit the
Yes.
coffee's kicking in. Also visit the
Woo!
merchandise store. And then more importantly, take a look at your caring docs, guys. This is something that is for us, by us, that can absolutely help our community. You've been rocking with us. Make sure that you share with other visionaries just like you. It's Chuck Hawkins, Hawk Vision Podcast, with the amazing Dr. Tamara Beckford. We will talk.
All right.